I think that I would love to see that happen more frequently at the hospitals. I'm up in New York, and during COVID, the number of people that reached out because of the same reasons, a lot of what Wendy was talking about, of just go, 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 go. And then you go home, you sleep, you come back, you go, 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 go. I had nurses that were locked on COVID floors. I had, it was a lot of just the unknown during that time. And I think the unknown was scary to everyone. I believe these kinds of supports and what you're talking about, the at least coming together for a moment of shared experience without trauma bonding, without everybody sitting into that, but as a way to kind of help build resilience and camaraderie and collaboration, which is at the root of most trauma-informed work anyway, is how do we collaborate together and have that shared moment. And I think that would be really beneficial in most environments, being able to have the guidance. And I particularly appreciate the fact, Wendy, that you shared that Jacinta would sit with the leaders at times, and it was just the leader. And sometimes that support trickles down in ways we don't think of. We often think just bottom up, or it's on you to do, but kind of in that middle range of management and leadership, I think is so important to have those spaces for guidance. And I think that could make a big difference in a lot of outcomes.
Absolutely.
I would say that what I learned from doing each of these meetings within departments, with the leaders, with the folks who were involved, is that if you think about group therapy in a clinical realm, it's the group members that heal themselves. Mm-hmm. And what I have found with Novant is that the team of people that show up for these meetings, the people who are invested in helping each other out, who are investing and finding ways to climb out of the darkness that this traumatic event brought them to, that once they all participate and know how the other folks are feeling, they really step up to help each other out and to think outside of the box in ways that they can support each other. And then that group of people really does heal each other. Yeah. It empowers them to be protective.
I think you're so right, Jacinta. I had a leader recently tell me after a Caring After Crisis event that there was about 6 team members who didn't know that each of them had lost a parent in that year. Yeah. And so through this other conversation, which was the loss of a patient, they ended up sharing that. And now they go out to dinner regularly and they just, support each other. And they wouldn't have known that had we not done that. And so she was just sharing, it was an amazing way for us to realize we're not alone. Especially, this was actually before Christmas and, with the holidays coming up and, it's just a lot. And so them feeling less alone by having fellow teammates, and they would not have known that had we not gotten in that shared space. And like you said, Jacinta, sort of that group work together of supporting each other.
Yeah. I mean, it normalized how they were feeling because they thought each one of them was alone in how they felt and the reaction that they were having. So I love the fact that I feel really great about the fact that they're all getting together outside of work and really, taking care of each other.
Yeah.
It just goes to show that we don't always know what somebody brings into an event. And that, if 80% or more of the patients that come into a healthcare setting themselves have already had pre-existing trauma, imagine how many of our own healthcare workers are coming in with their own losses and traumas and events that are going to impact the work they do, and being able to normalize it through, oh, you had that happen to you too. And that need to destigmatize or to normalize or define shared experiences is so impactful for healing and for continuing the work you do. So it's really powerful.
Yeah, you get me goosebumps, Wendy. Thank you.